Are going to talk about direct primary care today. I've had some particularly interesting conversations with employers this week about what DPC is, direct primary care, and what it can do for your medical plan. So I am going to explain a little bit about what it is, why it is gaining in popularity, why physicians are joining, creating this type of practice at a pretty good clip, and why it is often an almost perfect solution for both employers and employees. But first, what is DPC? So, direct primary care is a physician or a group of physicians that have opened a practice, charge a monthly membership fee for access to their services. And it may be a solo practitioner, it may be a doctor with a couple of nurse practitioners. Um, and other physicians on staff, could be, one, two, three, four, five providers, or in some states, there are really very large direct primary care practices with many locations across many parts of the state. So anything in between there. What they all have in common is that they work directly with the patient. They do not accept insurance. You don't have an office copay, you have an office fee if you need to go into the office. Most typically, you would pay cash pricing for labs or x-rays, and they might be included in your membership fee depending on whatever the practice decides. But the most important thing is to remember is that this is a physician or group of physicians that are practicing medicine the way they want to practice it. Most typically, that involves spending time with patients and not practicing paperwork. So there is really very little paperwork involved here. And what you'll find is that you may need something real quick. I'm a grown woman. I know when I have a sinus infection, I do have a DPC membership, and say, hey, I've got a sinus infection, and I get what I need to treat that sinus infection. On the other hand, when I have my annual exam, and I'm terrible about doing it every year, by the way, then I get my lab work, which I pay remarkably little for. And I also schedule a time to sit with the physician. And that appointment is almost always an hour, sometimes a little bit longer. And I'm healthy and I don't take any medication. So we go through my lab work, we go through my life, what's working, what's not working. Am I eating these green things called vegetables? Am I occasionally walking around the block? Am I getting enough sleep? How is my stress level? All of those kinds of things that contribute to your health, but aren't things that you can necessarily bill or charge for. And the result of that is that I almost never need to see another provider. I cut myself one day. I mean, really, my house looked like a murder scene. Um, I didn't go to the emergency room. I didn't go to an urgent care facility. I called my DPC doc and I was treated that way. There are remarkable stories of what a DPC doc can do. Typically, about 80% of somebody's medical need can be addressed by a primary care physician. To be clear, primary care physicians are not surgeons or oncologists, but they can guide and help quarterback just about anything that happens to you. So if this is interesting to you, two things. If you're in San Antonio, there is something called the San Antonio chapter of the Free Market Medical Association. And we will be having an event on the 27th of April. And one of our local DPC docs will be talking, Dr. Wes Clements. He is a great young physician who has the most remarkable office I've ever seen and has never practiced traditional medicine. He came out of medical school and he went right into direct primary care. Remarkable story. Lovely doctor, lovely practice, growing, um, really understands how to take care of patients and how to take care of himself also. And the Free Market Medical Association San Antonio chapter was founded by Dr. Roger Moxagemba, also a direct primary care physician. So if this kind of subject is interesting to you, come hear what they have to say. I'm sure you'll get a very interesting perspective. Also, other employers are always in the room, some of whom use DPC in their benefit plans, and I think you'll find that conversation quite interesting. So I'm going to give you a couple of questions to ask if you're thinking of integrating DPC either alongside your medical plan or as an integral part of your medical plan. You won't hear a lot about that in kind of the public discussion, but it is possible to integrate your DPC plan into your medical plan fully so you can harvest all of the savings, lower your employees' out-of-pocket costs, and give them a better user experience. Really is one of the few win-win-wins for everybody. So questions to ask if you are the employer or the employee, because you can go do this on your own if you wish. What services are included in the membership fee? Does it include routine care, screening, same day or next day appointments? Is there a fee for an in-office appointment? Or are all services, because you will have access to your physician or whoever's on call 24 hours a day by text or secure video? What are the fees for those services, if any? And what about labs and imaging? Some practices will charge a higher fee and include those things. Others will charge a little bit of a lower fee and pass those savings on to you with you paying whatever the provider pays. How many physicians or providers are available through the practice? Is it one? Is it 5? Is it 20? How many visits can I have during the course of the year? Is that unlimited? Is telemedicine or virtual care included in the membership? I'm going to say absolutely yes to this one. That is the whole point of DPC, is access to a physician when you need it, which is not always at 2:00 on Tuesday afternoon. What is the practice's policy on referral and specialists? This is particularly important if you are an employer and you're building this into your health plan. Are those things going to pass back into your health plan, or is there a cash pay arrangement available for other providers in your area? I like option 2, as I'm sure you might know. How do you handle prescription drugs? Texas is one of the few, if not the only state that where a DPC doc cannot dispense medications. But if you're in another state, your practice might be dispensing basic medications to you as well. They won't stock everything, but common antibiotics and common kinds of prescriptions, they probably will. And is that included in your membership, or are they passing those costs on to you? And if they are passing those costs on to you, ask what they are. I imagine you'll be quite surprised at how inexpensive they are. What is the practice's policy for after hours care? Typically what you'll see is that you have after hours access to your clinic or your group of providers. However, you may not have access to your provider. You may have to talk to the provider on call that evening. We use a couple of different clinics in San Antonio, and they each have a few providers and they take turns being on call. I don't think that's a particular problem. They do have EMR, medical record systems. So the notes of the visit will go in there, and they also all do rounding on a weekly basis. So if something is going on, they say what happened, steps are, all that kind of stuff. You do want to know when they're open, so if you need to go, that you can do that. And what the policy is on continuity of care in case your physician is not available. Doctors, as much as this is surprising to people, they're people. They get sick, they go on vacation, they go to conferences. So what is the policy if your particular provider is not there? Typically, that should be you are seen by an alternate provider in the practice. And finally, and this is probably a little bit more for employers, what is the practice's policy on data sharing and medical records? Are they electronic, and can you access them? So the answer to that should be yes. I know, like small organizations, anywhere data management can be a challenge. It's not an inexpensive proposition to manage data and make sure that it is accurate, secure, and available for the folks that need it and not for anybody else. But this is an important question to ask. If you are integrating direct primary care into your health plan, if you're an employer, this should be one of the first questions that you ask, because you want to make sure that you can capture what is being spent in the direct primary care relationship, both from the membership fee and the lab and the imaging and anything else that happens there, and what that would have cost you on your employee benefits, your medical insurance plan. That is an important, I think that's a fiduciary responsibility to understand how you're spending your dollars and and it will give you a good opportunity to see how effective DPC is and can be for your whole entire business, for your recruiting and retention efforts, for your employee morale, and for your budget. And again, win, 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 and not so many of those these days. So I'm going to leave you with that. We will drop the link to the next FMMA event in the comments so that you can attend if you'd like to learn more about direct primary care. And as always, you can reach out to me and I'll be glad to answer any questions. This is April 7th, Good Friday. Have a wonderful holiday weekend. Happy Easter, happy Passover, and we'll see you next time. Bye-bye.